the cranial foramina. So actually this is the session in which I am going to start with the most important topics of anatomy, which has to be completed if you want to target your NEET PG exam. So this is the first topic in this category. Actually, cranial foraminas, if you want to solve clinical MCQs also, so you have to know all the nerves which is passing through it and the important vessels and the nerves which is traversing through these cranial foramina. So it is very important that we should know that important topics and which are passing through it. So that is the whole important point to know. Okay, so my dear aspirants, before starting the session, let me just check, am I audible and everything is fine? So yes, everything is fine as I am seeing it. Okay, so let's start with the topic now. Yeah. So I would like to tell you about myself Dr. Monalisa, MD Anatomy from Armed Force Medical College, Pune. Now, special class features. When I am talking about the special class features, the platform is absolutely free for you. Polls are conducted. Raise your hands, get your doubts clear, write itself in the session, never ever miss a session. Once the session is finished, you can also download the PDF notes. Anytime, anywhere, read from the top educators of Unacademy platform. Use the code NAT10 to get 10% discount. I would also like to tell about the tomorrow's session. So my dear aspirants, please note down. I want you to know about the tomorrow's session which I am going to take so that you can be present. Okay, welcome Dr. Costa. So if I talk about tomorrow's session, that is lower limb MCQ marathon. So tomorrow also I am going to complete, like today also I have completed the thorax MCQ marathon. And tomorrow will be of lower limb MCQ marathon. I want everyone to be present live so that we can cover up the most important MCQs. Okay. So, and the session will be session first, second and third. The timing will be 6 p.m., 6:40 p.m. and 7:20 p.m. Okay. All of you can use the code NAT10 to unlock the session. You can use this code and be present live. You can use this code and unlock the free sessions on the Unacademy platform after downloading the app, Unacademy app. Crack NEET PG Combat. So all of you do present for the 19th Feb Combat test, 45 questions and 60 minutes timing. Use the code NAT10 to be present for this test. Ops, gynae, surgery, pediatrics and orthopedics MCQs will be asked. NEET PG 26th Feb. So 26th Feb is the day and 9 am is the timing in which NEET PG 22 All India mock test will be taken. Use this code NAT10 and do present live for this test. So all of you can enroll in this test by using the code NAT10. When I am talking about plus subscription, all 19 subjects can be completed in a very systematic way. You can be present for this session live and you can be the part of live and recorded version. You can study from topmost educators on the Unacademy platform. You can compete in live tests and quizzes. So study on the device of your choice and have an access to 25,000 more MCQs which is made by the top educators of Unacademy platform and also provided with a detailed explanation for each and every MCQs. By using the code NAT10, you get an extra discount of 10%. The same goes with the iconic subscription. So you can have the access to both Unacademy and that of the Prep Ladder. That means you can have an access to two best platforms. Already talked about the benefits of Unacademy. The benefits of Prep Ladder is added on clinical integrated essentials, video lectures from Dream Team. QBank 3 can be assessed, active revision, tags, treasure, dream notes of the Prep Ladder can be assessed. Use this code and get a discount of 10%. Now, congratulations to the toppers of FMG December session. I am very glad to share their image. Wish them best of luck so that they can target the session. They can target the session of the NEET PG and that of next in the first go with a very good rank. NEET PG all educator revision batch is going on. Be the part of this. Along with it, this is the whole detail of the test which is going on the platform and you can just pause it, enlarge it and see the date and the timing of test. Enroll by using the code NAT10. Other batches which is on the platform is Focus FMG December batch, Focus FMG 2022 comprehensive batch. So two batches of about the FMG course. Other batches for NEET PG course is ultra fast revision batch, NEET PG previous year question bank batch and also the NEET PG 22 image based MCQ batch. So all these batch are right now starting from tomorrow 16 Feb. So take the subscription, use my code to get an additional discount of 10%. Also, NEET PG subscription is showing you a drop in the pricing detail. So you can take the subscription, you can use this code NAT10 and get an extra discount of 10%. Same goes with the iconic Bonanza offer. The rates are quite low, as you can see right now. So avail this opportunity. This is till tomorrow. Till tomorrow it is valid, and take the subscription and get a discount of additional 10% by using the code NAT10. So let's start with the session now. Okay, so let's start with the session now. So I would like to explain firstly the cranial foramina. So actually a quick revision of cranial foramina. So let's start with the cranial foramina. So I would like to tell actually if when we are talking about cranial foraminas, I want to categorize that we should study all the important foraminas in this three. So we will study the foraminas in the anterior cranial fossas, then the foraminas in the middle cranial fossa, and then the foramen. So this is anterior cranial fossa, middle cranial fossa, and lastly the posterior cranial fossa. So one by one all important foraminas will be revised. So it is very important that the location of these foramina should be known by us, and also the structures traversing through it, because clinical MCQs will not directly ask about the structures traversing, but they will have a clinical note, but you can understand if and only when you are knowing the structures traversing through the foraminas in the anterior, posterior and middle cranial fossa. So let's talk about firstly the foraminas in the anterior cranial fossa. So if I just want to focus you on the anterior cranial fossa, so let's see the outline. Here we are seeing this is the outline of the anterior cranial fossa. And when I am talking about anterior cranial fossa, and if I enlarge it, actually what you are seeing is the anterior cranial fossa. You can see here that this is the cribriform plate with having very sieve like, you can see so many perforations are there, sieving is there, and also anterior to it here one foramen is there, that is foramen. So this is foramen cecum, and this is the cribriform plate. This is the cribriform plate of the ethmoid bone, and another foraminas which is located on either side here, which I am using green color. Actually these green colors foraminas are anterior and posterior ethmoidal foramina. Ethmoidal foramina. So that means it is important to know the structures traversing through foramen cecum. It is important to know the structures traversing through anterior, posterior, ethmoidal foraminas and that of cribriform plate. So let's talk about that. Okay, so let's talk about the important foraminas in anterior cranial fossa and the structures traversing. So firstly, I would like to tell you about the foraminas. So when I am talking about foramen cecum, so can anybody tell me which structure passes through foramen cecum? So I think many of the aspirants must be knowing it. So can anybody tell me which foramen passes through, which structure passes through foramen cecum? Dr. Kaustup. Which structure passes through foramen cecum? Okay, so anyone, foramen cecum, actually one of the important emissary vein passes through it, and this emissary vein which is traversing through foramen cecum is very important because it is forming a connecting link between the mucosal nasal vein and that of superior sagittal sinus. So the emissary vein which is traversing from the foramen cecum, it is forming a connecting link between the mucosal nasal vein and superior sagittal sinus. Now, so this was the first foramen. The other is cribriform plate of ethmoid bone. The other is cribriform plate of ethmoid bone. Cribriform plate of ethmoid bone. So through cribriform plate of ethmoid bone, olfactory nerve rootlet passes. Olfactory nerve rootlets passes. Olfactory nerve rootlet passes. Got it? Now let's talk about the other one, that is anterior posterior ethmoidal foramina. Anterior ethmoidal foramina and that of posterior ethmoidal foramina. Anterior ethmoidal foramina and that of posterior ethmoidal foramina. The structures traversing from anterior and posterior ethmoidal foraminas are anterior and posterior ethmoidal nerves and vessels. So it is very easy to memorize the structures traversing through anterior, posterior, ethmoidal, foramina. You can know it by knowing the names of the structures passing is same as the name of the foramen. So the structures are anterior, posterior, ethmoidal nerves and vessels. The structures are anterior, ethmoidal, nerves and vessels, and that of posterior, ethmoidal, nerves and vessels. Now, so that means we have done with the important foraminas in that of the anterior cranial fossa. Next is to know the important foraminas in the middle cranial fossa. Important foraminas in the middle cranial fossa. So let's talk about that. Okay. So important foramina, let me just enlarge this image so that you can, so we will talk about the optic canal. This is the optic canal, and just posterior, this is the lesser wing of sphenoid, and close to the lesser wing, this irregular small, actually the small part of this foramen is seen, this one, this will be the superior orbital fissure. It is covered by the lesser wing of sphenoid. So superior orbital fissure, optic canal, and this is the whole outline. So what you are seeing, this is the whole outline which you are seeing for the middle cranial fossa. And let's talk about the important foraminas line. So yes, we have done with this. This one is the small foramina posterior to superior orbital fissure. This is foramen rotundum, a oval shaped foramen, prominent foramen line just posterior to foramen ovale is foramen ovale. Posterior to foramen ovale is small foramina here which is seen, that is foramen spinosum, and an irregular foramen which is seen here, this irregular foramen which is seen here is called as foramen lacerum. That means for the middle cranial fossa, so if I am talking about middle cranial fossa, we have to know the structures traversing through optic canal. We have to know the structures traversing through optic canal, through superior orbital fissure, through foramen rotundum, through foramen ovale, through foramen lacerum, and also from foramen spinosum, Okay, so let's talk with the individual foramen. So let's see the first one. Structures passing through middle cranial fossa. So first let's talk about the optic canal, the structures traversing through optic canal. So anyone wants to reply, what structure passes through optic canal? Structures traversing through optic canal. Anyone wants to reply, which structure passes through optic canal? Anyone? Anyone wants to reply? The structures traversing is the optic nerve and that of no phasm, it's not vagus, and the ophthalmic artery. Ophthalmic artery and optic nerve. Here ophthalmic artery is a branch of internal carotid artery. Yes, phasm, optic nerve, absolutely correct. And also sympathetic plexus around ophthalmic artery traverses. So other than that, sympathetic plexus around ophthalmic artery traverses. So got it? So that means through optic canal, it is also starting from O, optic canal, and the structure which is passing is also starting from O, that is optic nerve and ophthalmic artery. Optic nerve and ophthalmic artery. Now structures passing through superior orbital fissure. The next is structure passing through superior orbital fissure. So for that I would like to show you this diagram. So firstly I would like to show you the diagram. Let me enlarge it. This is the orbit. This is the diagram which is showing the orbit, and you can see here this opening which you are seeing here. This is the opening, that is optic canal or optic foramen, and an irregular retort shaped structure which is also lying close to the apex of the orbit is superior orbital fissure. So we have to memorize all the structures traversing the superior orbital fissure. That can be memorized if we are knowing superior orbital fissure is also divided into 3 parts. So it is important that we should know all the 3 parts and the structures traversing through these 3 compartments of superior orbital fissure. So for that I would like to firstly show you this diagram. So see here. The superior orbital fissure outline has been shown, and you can see here this whole outline which you are seeing is of the superior orbital fissure, which is a retort shape, and in the center it is having a ring. Can you appreciate? This is the ring. So actually this is common tendinous ring from which the recti muscles are originating. Common tendinous ring, that is rectus superior, rectus inferior, rectus medial and rectus lateral muscles are originating. So you can see here that is superior rectus, inferior rectus, medial and lateral rectus. So these are the four recti muscle ring of annulus of Jin, and this is dividing, this is forming the middle component of the superior orbital fissure, and this is the lower component. So structures passing, so superior component is superior ophthalmic vein, LFT, lacrimal, frontal and trochlear nerve. Inside, if I talk about inside the annulus of Jin in the superior orbital fissure, we have got third nerve and the sixth nerve and nasociliary nerve. So superior inferior division of third nerve, the abducens nerve, the sixth cranial nerve and that of nasociliary nerve. The structures traversing through the lower part is the inferior ophthalmic vein which is traversing. Got it? So see here, I would like to divide the superior orbital fissure into three components, into three parts. So here from the lateral part, if I talk about its lateral part, from the lateral part of superior orbital fissure, the structures traversing is LFT. Lacrimal, frontal, that is the branch of the nerve. Which nerve? Ophthalmic division of trigeminal nerve, superior ophthalmic vein, trochlear nerve and the recurrent meningeal branch of lacrimal artery. Recurrent meningeal branch of lacrimal artery. So that is also traversing. Okay everyone. So this is also traversing through superior orbital fissure lateral part. Now if I talk about the middle component, the middle part, you have seen that the middle component of superior orbital fissure has got annulus of ring which is lying in the middle component, and the structures traversing is superior inferior division of oculomotor nerve, nasociliary nerve and that of abducens nerve. Exactly superior inferior, so we have done, so this is the structures traversing through the middle part. Superior inferior means both the division, that means both the division of third cranial nerve, nasociliary nerve and that of sixth cranial nerve. Now if I talk about the lowermost component or the medial component, medial part of superior orbital fissure, structures traversing is inferior ophthalmic vein, sympathetic nerve plexus arising and accommodating around internal carotid arteries. The most important is inferior ophthalmic vein traversing through the medial component of superior orbital fissure. So yes, these are, so we have till now what we have discussed the two foramens of the middle cranial fossa, that is the optic canal and that optic canal or optic foramen and that of superior orbital fissure. Other than that, many other important foraminas are residing that there. So I would like to tell you about each of these foraminas. Okay, so let's talk about foramen rotundum. So already I have shown you the location of foramen rotundum, ovale, foramen lacerum and spinosum. I want to tell you the structures traversing. So anyone who wants to reply, they can reply. Foramen rotundum. The third one, foramen rotundum. So can anybody tell me what structure passes through foramen rotundum? Which structure traverses through foramen rotundum? Any mnemonic also if you want? Anyone? What structure passes through foramen rotundum? You can memorize by me, M-E, me. Here M stands for maxillary nerve, absolutely correct, maxillary nerve. M stands for maxillary nerve, and E for emissary vein. Now, the fourth important foramen of middle cranial fossa is foramen ovale, and the structures traversing from foramen ovale is memorized by male. What is the mnemonic? Male. Through ova, what passes? Male passes, so M-A-L-E. So here M stands for mandibular nerve. M stands for mandibular nerve. A stands for accessory middle meningeal artery. Accessory middle meningeal artery, and L stands for lesser petrosal nerve, lesser petrosal nerve, and E stands for emissary vein. Absolutely correct, Kaustubh, Mansi, Manasvi. Okay, emissary vein. So actually through foramen ovale, the emissary vein is forming connection between pterygoid venous plexus and that of cavernous sinus. The emissary vein which is traversing through foramen ovale is very important as it is forming a connecting link between cavernous sinus and pterygoid venous plexus. It forms a connecting link between cavernous sinus and pterygoid venous plexus. Oh, spinosum. So who is this? Kaustubh has gone one step ahead only. Very good. So yes, next is foramen spinosum. So next is foramen spinosum, the fifth one. Structure traversing through foramen spinosum. Through spinosum, foramen spinosum, which structure passes? Nervous spinosum. What passes? Nervous spinosum. Meningeal. Actually, this is the meningeal branch of mandibular nerve. Nervous spinosum. The word nervous spinosum means meningeal branch of mandibular nerve. This is the one structure, and the other most important artery which is passing through the foramen spinosum is middle meningeal artery. Is the middle meningeal artery. Middle meningeal artery. Okay. So foramen spinosum. Next is foramen lacerum. So if I talk about foramen lacerum, few important structure passes. Actually, foramen to and fro, entire. So in many books it is written that not a much important structure passes, but when we are talking about foramen lacerum, few structures traverses through it. Actually, the structures traversing is meningeal branch of ascending pharyngeal artery. Yes, Dr. Kaustubh, it is covered by cartilage, but on the anterior aspect of foramen lacerum, few important structures are traversing. So you can write here meningeal branch of ascending pharyngeal artery. So can anybody tell me one important nerve is also formed at the anterior aspect of foramen lacerum? One important, okay Kaustubh, one important nerve is also entering from posterolateral aspect, and anteriorly it is forming one important nerve at its anterior aspect. That is nerve of pterygoid canal. Nerve of pterygoid canal. So exactly it can't be tell that it is passing to and fro, but it is related. Foramen lacerum is related to nerve of pterygoid canal, meningeal branch of ascending pharyngeal artery, and also emissary vein. Emissary vein passes through foramen lacerum, which forms a communication for the cavernous sinus. So the emissary vein which is passing through foramen lacerum is also important. Why? Because it is also forming communication with the cavernous sinus, the pterygoid venous plexus. The pterygoid venous, yes, Dr. Kaustubh, you are absolutely right. Widened nerve, which is the other name of nerve of pterygoid canal. So emissary vein which is traversing through foramen lacerum is also forming communication between the cavernous sinus and pterygoid venous plexus. So done with this, most of the important foramina of middle cranial fossa has been done already. So let's talk about the next, that is posterior cranial fossa. So in the previous year of examination, it is important foramina which has been asked is foramen magnum, internal acoustic meatus, foramen magnum, and hypoglossal canal. Also hypoglossal canal. So hypoglossal canal, jugular foramen. So importance, if I talk about important foramina to be remembered in this location, if I talk about important foramina to be remembered in posterior cranial fossa, it will be the following. It will be foramen magnum, It will be hypoglossal canal, jugular foramen and internal acoustic meatus. Internal acoustic meatus. So let's discuss one by one. Okay, so let's discuss one by one. So firstly, I would like to tell the structures traversing through internal acoustic meatus. Internal acoustic meatus. So write down, the first foramen of posterior cranial fossa is internal acoustic meatus. So the structures traversing from internal acoustic meatus is 7th cranial nerve, 8th cranial nerve, and that of one more structure is there. Anyone remembers? Some vessel also passes. So 7th and 8th cranial nerve passes, but along with it some vessels also passes. Can anybody tell me the name of the vessel which is traversing through internal acoustic meatus? 7th cranial nerve passes, 8th cranial nerve passes, labyrinthine artery. Yes, labyrinthine vessels, labyrinthine vessel. So labyrinthine vessels also traverses. Labyrinthine vessels also traverses through, that is also called as internal auditory vessels. In other words, it is also called as internal auditory vessels. Now, other than that, hypoglossal canal. Hypoglossal canal. The structures traversing through hypoglossal canal, again it's very easy. By the name only it is clear the structure or the nerve traversing will be. The structure or the nerve which is traversing through hypoglossal canal. I would also like to write the other name of hypoglossal canal is also called as, it is also called as anterior condylar canal. It is also termed as anterior condylar canal. Hypoglossal canal is also termed as anterior condylar canal, and the structures traversing through it. The structures traversing through it is the 12th cranial nerve. By the name only it is clear, the hypoglossal nerve which is called as 12th cranial nerve. Okay. Okay, 12th cranial. So write down, it's the 12th cranial nerve. 12th cranial nerve or hypoglossal canal, through hypoglossal canal, and also meningeal branch of ascending pharyngeal artery. Okay. So anyone wants to give answer? Okay. Also meningeal branch of ascending pharyngeal artery. Meningeal branch of ascending pharyngeal artery traverses. Now, which two important foraminas remains? One is jugular foramina, another is foramen magnum. So I would like to firstly, I would like to explain that when I am talking about jugular foramina, again you can remember the structures traversing those jugular foramina by seeing this image. Jugular foramina is also divided into, three compartments, and it is important that you should know the structures traversing through these individual compartments. So, through its anterior aspect or anterior compartment, the structures traversing is inferior petrosal sinus. The structures traversing through its middle part, you can say this one, is the 9th, 10th and 11th nerve. 9th cranial nerve, the 10th vagus cranial nerve, and that of accessory or 11th cranial nerve. And along with an artery which is traversing is the meningeal branch of ascending pharyngeal artery. Meningeal branch of ascending pharyngeal artery. So my dear aspirants, please note down, this compartment which I am encircling here is the middle compartment. This will be the middle compartment of jugular foramen. This will be the middle compartment of jugular foramen. Through this, glossopharyngeal nerve passes, vagus nerve passes, accessory nerve passes, and that of meningeal branch of ascending pharyngeal artery passes. Through anterior one. So, through anterior compartment, you can say inferior petrosal sinus. Now, let's talk about the posterior part of the, let's talk about the structures traversing through posterior part of the jugular foramen. Meningeal branch of occipital artery, emissary vein, and the junction of sigmoid sinus with the internal jugular vein. So these are the structures, emissary vein and the sigmoid sinus and the meningeal branch of occipital artery. These are the structures traversing through jugular foramen from anterior to that of the posterior aspect, divided into 3 compartments. Now moving on to the next, that is the foramen magnum. So when I am talking about foramen magnum, it is important for you to note down that the foramen magnum is also divided into 2 compartments. So actually it is divided into 2 compartments, anterior and posterior. Again, the anterior compartment is called as osteoligamentous compartment. The reason why it is called as osteoligamentous compartment is because only ligaments passes through this bony foramen, and through the posterior part, neurovascular compartment. It is called as neurovascular compartment because the structures traversing through it is the nerves and vessels. Now, alar ligament. When I am talking about this alar ligament is attached on either side of the tubercle of occipital condyles. It is attached onto the tubercles of occipital condyles on each side of foramen magnum, and again foramen magnum is divided into anterior one and that of posterior one. It is divided into, again it is divided into anterior smaller compartment and it is divided into posterior larger compartment, 2 compartments. Okay, so it is divided into anterior and that of posterior compartment. Okay. What is the structure which is dividing into anterior and posterior compartment is the alar ligament. Now let's talk about the structures. So next important point is, where is this alar ligament attached? So the compartment, as we know, anterior and posterior, there is alar ligament which is dividing the whole big foramen into 2 parts, anterior and posterior. So this alar ligament is attached on either side to the tubercle of the occipital condyle. So please note down, alar ligament which divide the foramen magnum into 2 compartments, anterior and posterior, is itself attached onto the tubercle of occipital condyle on each side, and divide the foramen magnum into anterior, the smaller compartment, and the posterior, the larger compartment. It is attached onto the occipital condyle tubercles, So that means if I am going to enlarge this image, so I am just wanting to enlarge this one image. So all of you just understand this. So if I am enlarging it, I would like to show you this tubercle. So this is the occipital tubercles here. This is the ligament which is connecting it. So just to make you understand, what is this ligament termed as? This ligament is termed as alar ligament. Now alar ligament, that means it is dividing the whole foramen magnum into 2 compartments. The one which is lying anterior to it, this one. So this compartment is anterior. The one which is lying posterior to it, this one. So this whole posterior larger compartment, this is the posterior compartment. The other important point which has to be understood by you, that the anterior compartment is also called as osteoligamentous compartment. Now why osteoligamentous compartment? The reason is that only ligaments pass through it and it is a opening in the bone, so it is osteoligamentous compartment. This is the anterior one and the posterior one. When I am talking about the posterior one or the posterior compartment is called as neurovascular compartment. Why? Because nerves and vessels, neurovascular compartment, because nerves and vessels traverses through it, so it is called as neurovascular compartment. So is it okay, everyone? Is it okay? So that is the reason the posterior part is called as neurovascular compartment. Now let's see what are the structures passing through anterior compartment and what are the structure which is passing through the posterior compartment. So now this is just a schematic diagram to make you understand the structures traversing. So the anterior compartment, the structures traversing is, through anterior compartment, the structures traversing is apical ligament, superior band of cruciform ligament and membrana tectoria. 3 structures traverses from anterior to posterior in the anterior compartment: apical ligament, superior band of cruciform ligament and membrana tectoria. Posterior compartment, anterior spinal arteries, the vertebral artery, spinal root of accessory nerve, also the cerebellum, tonsil of cerebellum. So you can appreciate that the structures which is passing through the posterior compartment is medulla oblongata, lower part also, the posterior spinal arteries, the anterior spinal arteries, the spinal accessory nerve, also the spinal accessory nerve, the vertebral arteries and spinal root of accessory. Let me write it for you. So let me write it for you so that you can revise it. So the structures traversing through anterior compartment. Now, the structures traversing through anterior compartment, from anterior to posterior, we have got three structures, and these three structures are apical ligament, of dense, upper longitudinal band of cruciform ligament, superior band, you can say superior band, superior longitudinal or upper longitudinal band of cruciform ligament, and that of membrana tectoria, Now, also the structures traversing through the posterior part of foramen magnum. Now, structures passing through the posterior compartment of foramen magnum, which is also termed to be neurovascular compartment. Structures traversing through posterior compartment, which is also termed to be neurovascular compartment, is following structures traverses through this. The structures are lower end of medulla oblongata covered with the meningeus, fourth part of the vertebral artery surrounded by sympathetic plexus of the nerve, accessory nerve, anterior, posterior, both the anterior and posterior spinal artery, and also the tonsil of cerebellum. So these are the structures which is traversing through posterior part of neurovascular compartment. These are the structures which is traversing. Okay. So in short, we have revised all the important foraminas of all the three fossas, anterior, posterior and middle cranial fossa. Many important MCQs has been asked in the previous year in the NEET PG exam, and it is important that you should revise it. And also when I will come up tomorrow with the important topics targeting for NEET PG 2022, I will discuss few MCQs related to this topic also. So this is how we are going to cover up. So my dear aspirants, before ending the session, I want you to know about tomorrow's session, that is lower limb MCQ marathon. Tomorrow is a special class, 3 special class. All of you do join this 3 special classes. That is going to happen on 26th of Feb. Session 1, 2nd and 3rd, 6 p.m., 6:40 p.m. and 7:20 p.m. All the sessions are just of 30 minutes. So do join at the correct time. Download the Unacademy app and thereafter use the code NAT10 to be present live for this session. This will be highly beneficial for you, and I want everyone to be present for this session so that we can quickly target all important MCQs related to the topic of lower limb. Those who have not downloaded the Unacademy app till, should definitely go for it and download it. Also, I want you to tell about crack NEET PG combat test. So when it is going to happen? It is going to happen on Feb 19, 6 p.m. evening is the timing. Orthopedic, obs, gynae, surgery, pediatrics MCQs will be asked. So top rankers are gifted with exciting prizes. So avail the opportunity of taking all the exciting prizes to your home. Use this code NAT10 for enrolling in this free test. Crack NEET PG with the combat. So enroll in this free test and be present for this test. Also, I want you to give information regarding 26th of Feb, All India mock test. 9 a.m. is the timing on the pattern of NEET PG examination. This is absolutely on the free platform. Enroll in this test by using the code NAT10 and be present live. So this will be exactly on the pattern of exam which you have to give. So just avail this opportunity. Get enrolled in these tests. Very, very beneficial for you. And what I want everyone to be present for tomorrow's special session. The timing, as I have already told you, 3 sessions. Topic is lower limb MCQs marathon, 16 Feb tomorrow. 3 sessions, 6 p.m., 6:40 p.m., 7:20 p.m. Each session is of just 30 minutes. So all the best, keep studying. Thank you so much. We will again meet tomorrow with the session, and those who watch the session on the special class, they can also download the PDF notes. So do like, subscribe the channel Let's Crack NEET PG, and use my code NAT10 if you are wanting to avail the opportunity of being the part of free session, and also if you want to take the subscription, you will get an extra discount of 10%. All the best, keep studying. Thank you so much.